more opportunities for you to call and be part of our discussion today on Ask the Expert with Dr. Bernie Lalonde from the Chrysalis Rejuvenation Clinic. Make sure you give us a call, 613-789-6559. Email ottawa.morning@ctv.ca, and there's our Facebook, CTV Ottawa Morning Live. Simple as that. We got some great questions coming up. And the first of which actually is going to be by email. I believe Samantha has submitted a question to us. So let's take a look at that here. And this is something you're dealing with all the time now. I'm a 30-year-old woman who has a problem with excessive sweating. I heard I can get Botox in my underarms to help with this. Is that true, doctor?
Well, without a doubt, it's true. It's actually one of the most widely accepted forms of treatment.
Did this come across by accident? Interestingly enough, because Botox is usually something to think of, to eliminate lines and that sort of thing.
I am not exactly sure how it came about. We do know that Dr. Carruthers and Carruthers discovered the cosmetic use of Botox, and they're Canadian physicians on the West Coast.
Yeah.
But how it came to be treated for hyperhidrosis, I'm not exactly sure. Probably was serendipitous. In other words, they were treating for something else, and they noticed.
Which is often the case with a lot of things.
Exactly.
Yeah.
But without a doubt, you can have an excellent result with Botox, Samantha. It is something that lasts usually anywhere between 6 and 10 months. I've had people lasting up to a year. But the comments you get back says, boy, I wish I had heard about this earlier because this has changed my life.
Because for a lot of people, it's super embarrassing and super hard to deal with.
Exactly. I had someone who was a teacher, and she says, I couldn't even write on the chalkboard anymore because I'd lift up my arm and there was this big wet spot. So, I mean, socially, you'll see a dramatic change. It takes about a week to kick in.
Right.
And
lasts 6 to 8 months?
And yes. And the average is about 8 months. A very, very high patient satisfaction with this.
Yeah.
So drop into the clinic or give Susie a call at our clinic, and we can set something up for you.
Again, nothing will happen until you have a little consultation and get yourself all set up, right?
That's right.
Yeah. All right. Who's our next caller? Shelley is on the telephone this morning. Good morning, Shelley. How are you? Hello, Shelley. We still have Shelley over there. Hello, Shelley. I guess we don't have Shelley any longer. This is a common question, though. This sweating issue.
And increasingly, the nice thing about it too is that a lot of extended healthcare plans will pay for this because instead of being on a medication, and most of my patients have tried medications before. They've either had side effects from the medication, intolerability of various sorts, and they want to go to something that doesn't have side effects. And so Botox is right up their alley. And I think we've had probably 90% of our clients who have had Botox for hyperhidrosis have been covered by the insurance plans.
Really?
Yeah.
People should look at this, right?
Absolutely, because in this town, the majority of people are covered with extended health care plans.
Yeah. All right, Sharon's on the telephone. Hi, Sharon. How are you?
Very well, thank you.
Very good. What's your question this morning?
I'm just wondering about the cost and if OHIP is looking at this as a feasible treatment.
Right. Well, we were just talking about this in regards to the hyperhidrosis.
That's right. I mean, OHIP, of course, does not cover any medication. So Botox is considered a medication for sure. OHIP does not cover this. Now, your extended healthcare plans, if you're lucky enough to have one, the chances are very high that they will cover this. So you're looking at anywhere, depending on how many units are used, in the 600 to 800 category, roughly, for both armpits. That's the average price range, somewhere in there.
What about when it comes to crow's feet and that sort of thing?
Cosmetic Botox for sure is not covered by any healthcare plan.
No.
Because that's considered cosmetic. So looking around the crow's feet, you're looking at $100 to $150. The frown lines in here, you're looking at anywhere from $250 up to $400. Somewhere in that range. So it depends on the quality of your contraction, how strong your muscle is, the number of lines that it produces when you frown, and then we make it's an art, so you make an estimate of what you need. It's always easy to add a little more if the amount used initially isn't sufficient,
right?
Rather than load you up with a whole extent,
Might I throw out a warning out there? I mean, I've seen talk shows on the whole thing where people try to do it on the cheap and go to places that are not reputable places to get things done. I'm not sure if there are any here in the nation's capital area, but people should be careful.
Well, as a physician, obviously, I feel that when you have a procedure that involves inserting a needle into your face, that you should go to a physician-directed clinic I think there are a lot of non-physician injectors there, but they tend to work in clinics with physicians, and I think that's perfectly valid. But I would beware, if I were a consumer, to go to a place where they have no physicians involved at all.
Yeah. You oversee, I mean, you don't do
well,
every
I do
injection.
all the injections.
Oh, you do,
I mean,
eh?
We don't have any nurses or technicians that do the injections. Injections is my bag.
Right, right. So you not only oversee the whole thing, you do the injections
That's
yourself.
right. Well, I mean, you're putting something into somebody's face that person has to have trust in you because, it's their look, and you don't want to botch things up. There are potential side effects from anything, and certainly from Botox, there are a few. Not too many, but still, that person doesn't want to all of a sudden have a droopy mouth or a droopy eyelid, and that can generally be avoided.
Yeah, you got to be careful. You got to check into things. It's just like anything else you're buying these days. All right, a quick break, but when we come back, more questions, more answers with Dr. Bernie Lalonde from the Chrysalis Rejuvenation Clinic here on Ask the Expert. There's the phone number, there's the email address, there's our Facebook site, so make sure you drop by, ask us a question. We'll be back with more after this.